Okay. I learned something that completely blew my mind, and I have to tell y'all. So, there's two types of diabetes. Type 1 tends to affect the young. It's an autoimmune reaction where the cells in your pancreas that are responsible for making the hormone insulin, they get wiped out. Type 2 tends to affect overweight adults, and that's when their bodies don't respond well to insulin. Well, did you know that scientists believe there's a fifth type of diabetes, potentially impacting millions of people around the world? Let me explain, but let me introduce myself. Hi, y'all. My name is Miriam. I'm a science reporter. And before you go off and say, Miriam, more diabetes, more things to worry about, let me lay down some knowledge for you. Let's set the scene. It was the 1950s. Philip Hugh Jones was a British physician running a diabetes clinic right outside Kingston, Jamaica. For the most part, the people he saw, they fit either type 1, type 2 diabetes, but there was like a small group of people. They were young, very thin, very malnourished looking, and they didn't fit either of the boxes. It was very perplexing to him. Like these folks seemed like they should have been type 1 diabetics, except for the fact that they had never experienced a common symptom of type 1 diabetes, which is diabetic ketoacidosis. This is when, because glucose can't get into your cells, it needs insulin to do that, the body will then resort to using fat as fuel. But breaking down fat creates these chemical compounds called ketones. And when ketones build up in the blood, it makes your blood acidic. Not a good thing. In 1955, Hugh Jones published a paper describing these cases of what he called Jamaica or J type diabetes, and thereafter, similar cases were reported across the world. 30 years later, in 1985, the World Health Organization was like, bet, we're going to recognize J type diabetes, classifying it as malnutrition related diabetes mellitus. Unfortunately, in 1999, the organization walked back on that, saying that there wasn't enough scientific evidence to link malnutrition directly with diabetes. Since then, more research has been done into malnutrition related diabetes mellitus, and the picture that is now emerging is that poor nutrition early in life, as early as like a baby growing in its mom, it messes with those cells in the pancreas that are responsible for making insulin. It's not fully understood how much malnutrition tips the scales in favor of type 5 diabetes, malnutrition related diabetes mellitus, or what other extenuating factors there are. But the International Diabetes Federation officially recognized type 5 diabetes in April, and it organized a committee of scientists to better understand, diagnose, and treat the disease. We as a planet are staring down the barrel of food scarcity and food crises across the world in places like in Asia and Africa, South and Central America. So this recognition and the research into type 5 diabetes comes at such a pivotal time. I know talk about a fifth type of diabetes, not exactly the most lighthearted science news, but if you enjoyed and you like to hear more science news, follow me